This is Jody Tropiano, the Content Director for Health, and I'm here with Sean Duffy, the co-founder and CEO of Omada Health. Sean, thanks for joining us.
Jody, thanks so much for having me and happy to be on.
Great. So we're going to chat a bit about what Omada is doing in particular, and also the COVID pandemic at large. So we'll hop right into it. So Sean, first, if you can share with us what Omada's been working on and how you guys are battling the current pandemic.
Sure, Jody. And firstly, just even before that, just my heart and thoughts go out to everybody who's been impacted by COVID-19, friends, family, healthcare professionals, the heroes on the front lines. But thoughts are with you. For Omada in particular, it's been very, very busy time. I think for many of us, it's been a busy time as we ran through, what we needed to do to really equip our company to best serve our customers, to best serve our participants. It started with, as you might imagine, taking care of our employees. So, making sure that everybody's healthy, instituting global work from home. Thankfully, we had a lot of remote workforce right out of the gate, so a smooth transition. And then I'm really thinking immediately about what can we do for our customers, our health plan partners, and our participants, starting with participants, which is our first value. So the product teams kicked into high gear a huge effort to really reimagine certain aspects of the program to be responsive to COVID, to best support a lot of the trends that we saw popping up in the data, because it was instantly clear that given what's on people's minds in the country, given what they're facing in their personal life and their health life, that we needed to really tune the Omada experience to best meet needs. So it's been all hands on deck to make that happen, and have produced some just amazing changes.
Great. And how have you been seeing those trends pop up in both your behavioral health program and your chronic disease programs?
So, first, a huge wave of anxiety. No surprise, or that wouldn't be a surprise to anyone. I think as March played its course, there was just this moment where a tidal wave of anxiety really flooded our members and our participants. And we had 10x increases in asks for help with depression, in asks for help with anxiety for our program. And now this is for our program for people with prediabetes, for people with type 2 diabetes, for people with hypertension. It's those individuals asking for support with anxiety. So it was crystal clear that needed to be one of the key pillars in the COVID-19 adaptation project that we had, go forth at Omada. That led to a whole host of efforts, not just including those, but those that also led to the offer out to our customers, our health plan partners, and frankly, any employer and health plan across the country to take advantage of free support for Omada's mental health programs, including anxiety and depression.
That's great. And what about anxiety and depression right now is so dangerous?
Well, a couple of things. One, it's dangerous anyway. Depression, anxiety is a headwind when you're trying to make lifestyle change. You see that. We saw that even before COVID. That's a known reality of what people are up against. I would say that in this particular moment, it's scary and it's very hard to manage a chronic disease when you're completely isolated, when you're very, very lonely, when you're very, very anxious. So that really can exacerbate the challenges that you have in other medical conditions. So it's it's one of those interesting and unfortunate realities where you get more depression, more anxiety. There's actually a secondary health cascade above and beyond that we really needed to support people through and need to continue. And that makes it especially, I think, and dangerous and really required to do something about in this time.
Mm-hmm. And I think, recently mental health has definitely been front and center with this crisis and talked about a lot more. Do you think that this crisis will have lifted the stigma around mental health care for good?
Absolutely. And frankly, I think for one key reason, everyone has experienced it themselves. I would wager it's tough to find a single person across the country, myself included, that over the last 6 weeks hasn't felt, wow, I'm feeling an incredible wave of anxiety. I have to work to coach myself through it.
Yeah.
That's just what's happened. I've been joking with people. I'm blessed with a wonderful, beautiful baby girl who's 6 months.
Oh,
and has no idea that the pandemic's happening. And I'm like, I keep joking that I want to do a randomized controlled trial of looking at baby Letta versus like an SSRI and see if that's the cure for the world. But it's everyone's experiencing that. And I think what happens from a stigma standpoint, the number one way to reduce stigma is to allow people to recognize they've had a personal experience here. And I think because anxiety in this crazy moment for the world is spread quite broadly, on the other side, I think it'll reduce stigma. And I think we'll have better mental health services, writ large across the country as a result of COVID-19.
I hope so.
Me
And so
too.
how about employers who are kind of coaching and guiding their employees through this time?
Yep.
What advice would you give them if they're looking just to keep their employees happy and healthy and just check in on them from time to time and make sure they're doing okay?
Yep, absolutely. So the advice I'd give is really project plan against key needs to support your employees, right? So, and that's going to change, frankly, over the course of the rest of the year here. So right now, anxiety, depression, you've got to support your employees. Without doing that, you're reducing the chance that they can stay productive in this difficult time, and then B, it's just the right thing to do. So make sure that that's the case. In the background, what's happening is people are foregoing in-person healthcare services that they would have otherwise had. And in many ways, that's the headline behind the headline, because if you have type 2 diabetes, do you really want to show up to get your A1C test right now? Are you not, doing health behaviors that you otherwise, probably should be?
Mm-hmm.
So I think as we tip toward the back half, it's not, not just diabetes, not just our space, but employers need to be thinking about, all right, in a world where we're going to have a period of time till there's a vaccine, how do I make sure that my employees are able to stay healthy as best as possible
Mm-hmm.
in a way that's digital first? So I think that, right now, guidance we give, really think about anxiety, really think about depression. Very soon thereafter, think about how you can support your employees digitally, because in large part, it's going to be everybody's preference to not walk into a doctor's office unless you need to in today's era until there's a vaccine.
Mm-hmm. And you mentioned digital. So digital health has arguably really stepped up to the plate during this crisis. So what role do you think digital health has played in the crisis so far?
Well, I think it's played a huge role in the crisis because you've had everyone across the country thinking about ways that they can access care without going in person, and digital tools have been extraordinary gap filler on that. So whether it's all of a sudden employees being, well, interesting, do I have something, either a telemedicine service, either a Omada program or otherwise that I could gain access to,
Mm-hmm.
without showing up in person, and do I have somebody to turn to? For us in particular, I mean, Omada is a very people-forward program and offering that's just kind of our mantra is always humans matter in a big way. I think in today's era, humans matter even more, and connecting digitally, with other folks that can care about your health without having you come in person, has been already a key, role in aiding in the crisis that we have right now.
Mm-hmm. And how about kind of on the other side of this crisis? I know it
Sure.
seems like so far away that we'll be
Yep.
talking about the other side of this, but
I
when
know.
we
I know.
do,
I know.
I hope it's sooner rather than later,
Me
but when
too.
we do eventually get there, what will have fundamentally changed for digital health? What does it look like at that point?
Well, I mean, it's going to be completely different. I would say that over the course of the last couple of months, I mean, we've had a decade's worth of healthcare innovation. And it's interesting. I think there are two primary drivers here that are they're indisputable. Driver number one is I believe that a lot of the, maybe not all, but a lot of the regulatory changes, the billing changes to support digital care
Mhm.
will be sticky. Even if right now they're viewed as temporary, I think they will be sticky because I think that they're meeting needs in new ways.
Mhm.
Second to that, consumer behaviors have changed. And once folks try things and they test the waters in new ways of getting care, it makes it more likely that they continue forward with it. You can think of even Zoom as an example. Families across the country are now using Zoom. It's morphed into a consumer product. That's going to stay. Like, I don't think that's changing. Same with digital care. My mom, who is tech savvy enough to open an app, but you'd be hard pressed to um, view her as a tech expert here, is now of the mindset that, well, why would I need to go into my doctor that I had, on a monthly basis been driving in for these routine needs. Like, I think I'm going to FaceTime even on the other side of this. So I think those two things have changed. And, and that's going to be persistent, and it's going to mean that 5 years from now, the state of healthcare will look like it maybe would have looked 15 years from now if COVID-19 didn't happen.
Yeah. And bridging on that, so how about the broader health ecosystem? What changes happening now do you think will stick? And maybe touching on how people interact with the health system, how will that fundamentally change?
Yeah, perfect. So I think the changes that will stick, some of the ones I referenced, I think telemedicine reciprocity ideally will, change. I think states will have more reciprocity rules. I think that'll stick. I think virtual billing codes, billing for digital visits, just enabling digital billing, I think that'll stick. Payers and others across the country have already made adaptations to make that a plausible reality. And then consumer behavior is going to stick. I think once the door's been open, people have walked through it, they're trying care in new ways. That will be persistent, no doubt.
Great. And any last thoughts? I know you're in the Bay Area, so
Sure.
what's the mood there? How are people reacting? Are they remaining positive for the most part?
Yeah, I mean, I think for the most part, the Bay Area's been, knock on wood, like in large part blessed. I mean, we've, flattened the curve. No hospitals here are over capacity. We've been in a position to be able to actually, loan ventilators to other, more impacted places across the country, which made me very, very proud. So, thus far, I've been really inspired by the efforts in the Bay Area. I think that's been good. And I think the other thing that just like, I think just we all need to remind ourselves with is we're going to get through this. I mean, in many ways we're blessed. It seems that the characteristics of the virus is ones that we can, build a vaccine against. We're going to have tools in the arsenal, like, never before, at least in my life, has there been every single person across the globe, every smart mind persistently thinking about how to solve this. And, the power of the human spirit and entrepreneurialism is in full force here. And so, I think that over the next couple of months, we'll start to see, the best of humanity come to be here.
That's great. It's a great place to end it. Thanks for taking the time, and congratulations on all that you're doing. We applaud you for your work, and we look forward to chatting with you again in the future.
Awesome, Jody. Yeah, thank you so much. Honored to be on.
Thank you. Thanks for watching this interview. We're doing our best to keep our health community up to date and informed as the pandemic progresses. So please check back for more interviews and blog pieces with leading health experts, as well as check out our Health COVID resource page for more information. Thanks again.